Aloha, everyone. I'm Dr. Tom Johnson from Kalani Total Health Center, your one-stop holistic health shop. Today, we're talking about arthritis. What we should really need to do first is define what is arthritis. Well, let's talk about osteoarthritis, otherwise known as degenerative joint disease. Yes, osteoarthritis is a disease of the joints. We need to think about it in that way so we fully understand it. Osteoarthritis is the most common arthritis found throughout the world today. The etiology and risk factors are very well known. Age. Women are affected more than men, although men are somewhat equally affected as well. It spares no country, culture, ethnicity. It's found throughout everywhere. Prior injuries, static postures, repetitive motions, other pre-existing conditions, all can affect the degree of arthritic change or deformity that we see with osteoarthritis. Now, what are the symptoms and signs of arthritis? Well, think joints. So pain, stiffness, dysfunction, deformity, weakness around a joint, whether it's a shoulder, neck, back, hip, knee, foot, ankle, fingers, wrist, it affects joints. It is a disease of the joints. And those are the hallmark signs of arthritic pain. I have stiffness around the joint. There's some deformity of the joint. It's not moving as well. It's painful. It's swelling. It's flared up with activities. All are common presentations. Now, we can separate arthritis into two major categories. We can talk about osteoarthritis, the most common arthritis found throughout the world today, the most common cause of pain and disability in the world today. And then there's a second category of inflammatory arthritis. That's a separate topic and a separate lecture, but it needs to be considered in what's called the differential diagnosis of your arthritic pain. More on that later. Osteoarthritis. There's some lifestyle factors that play a key role in you developing arthritic changes more quickly and progressing. First, your age. Yes, it is a disease of aged joints. However, the early onset, the early factors that give rise to those changes later on are actually found in our youth. Traumas, poor postures, technology, cell phones, gaming, inactivity, car accidents, falls, repetitive motions, all lead to the arthritic changes later in life. They can all be prevented. Now, what is the traditional Western medicine approach to treating osteoarthritis? Well, we do a great job of Western medicine. We can prescribe braces for that knee or back or neck. We can prescribe medications, oral, topical, or inject into the joint itself to get people out of pain. We can recommend a gentle exercise program to strengthen the joint, so physical therapy or occupational therapy. All are great solutions. However, if that was the answer, then why are we having an explosion exponentially in arthritic disorders and surgeries for arthritis, from knee replacements, hip replacements, spinal fusions? People are suffering, getting worse and worse year after year after year. So if our traditional Western approach was the answer, we should see a decline, but we don't see that. We see the opposite. So what do we do different here at Kalani Total Health Center? The answer is simple. We use a multidiscipline integrated approach from our medical doctor, physician assistant, nurse practitioner, our medical team, all the way over to our active care team, our chiropractic doctors, physical therapy, massage therapy, clinical nutrition, acupuncture, all are designed to get patients more active. Now, when we bring those elements together, Western medicine with more active care, physical medicine, as I like to term it, we bring those elements together, that's the solution. That is the state-of-the-art treatment for osteoarthritis found today. We need to get you out of pain, control your pain, inflammation, swelling, but we have to get that joint active, moving it better, and get it stronger at the same time. We then have to prescribe a therapeutic course of corrective care exercises to get you back to your activity. The older approach to simply tell the patient, well, doc, it hurts if I do this. Well, don't do that. Okay, that is like 100 years old mentality. No, we need to get that patient moving better again. So we need a progressive therapeutic approach that gets patients not only back to their life and daily life and normal activities, but gets them more active in terms of sport, activities, travel, hobbies, getting them more active. So it's not good enough to say, well, just don't do that. Okay, that's an old school approach. That doesn't work anymore. We need to get your arthritic joints more active. All right. How do we eliminate arthritis? Well, there's no cure for arthritis in that sense. I cannot turn a 67-year-old patient with arthritis back to age 16 or 18 again. However, I can make that arthritis more functional. I can get patients out of pain, and I can get you more active and more functional and stronger and healthier. So we can push back the clock of time with those methods, but we can stop the arthritis from progressing. And that's the key. We need to manage arthritis. There's many conditions in medicine that are no cure, like a type 1 diabetes. Similar with osteoarthritis. There's not so much of a cure, but there's a proper management. And that's what we do different here at Klondike Total Center. We manage your case. We try to prevent the arthritic changes. We get the arthritis more active. We get that joint more healthy. We get you back to your quality of life. That's what really separates us from all others, our multidisciplinary and integrated approach. All right, everyone, I hope you enjoyed this little tidbit on osteoarthritis, otherwise known as degenerative joint disease. Let's get you in the clinic. Let's get you checked out, and let's see how we can get you back to your best life now. I'm Dr. Tom Johnson from Klondike Total Health Center, your one-stop holistic health shop. Mahalo and aloha.